Hello guys and welcome back to my YouTube channel Clinical Cases Simplified. So today I have another set of flashcards on genetics. Why genetics? Because it did not stay in our minds after we are done reading it for long. Now the last set of flashcards was totally random. From now on we are gonna move topic wise. You can also drop your suggestions in the comment box below. So by now, I hope you have revised the previous flashcards. And if you've got them correct, then congratulations, you are doing really great. If you haven't checked out the previous video yet, I'll put the link for you in the description box below. Okay, so enough of the talk, let's move on to the walk now. The instructions are same. On one side of the flashcard, you're going to see a typical presentation, and on the other side of the flashcard, you'll see the diagnosis. Please pause the video first in each flashcard and try to figure out the answer by yourself, and then when you're done guessing, I'll reveal it to you on the flashcard. So let's begin. On the first flashcard we have Arachnodactyly, upward and temporal lens dislocation, aortic dissection and hyperflexible joints. What do you think the diagnosis is? Marfan Syndrome. It is caused by a fibrillin defect. Basically, Marfan syndrome is an autosomal dominant connective tissue disorder in which there is a mutation of FBN1 gene located on chromosome 15. This leads to defective fibrillin synthesis, and fibrillin is a glycoprotein that forms a sheath around elastin. Moving on to next flashcard. If you see Meconium ileus in a neonate, recurrent pulmonary infections, nasal polyps, pancreatic insufficiency, infertility or subfertility, what will be your diagnosis? Cystic fibrosis. Cystic fibrosis is caused by a gene defect of CFTR gene. It is located on chromosome 7. To be precise, it is most commonly the deletion of PHE508. Moving on to next flashcard. When you see infant with a cleft lip or palate, microcephaly or hollow prosencephaly, polydactyly and cutis aplasia, can you think of a diagnosis? It is Patau syndrome. Basically, in Patau syndrome, death occurs by first year of life. Next, infant with microcephaly, rocker bottom feet, clenched hands, and structural heart defect. Can you think of a diagnosis? It's Edwards syndrome. It is the second most common trisomy after Down syndrome, and in this too, like Patau syndrome, death usually occurs by 1 year of age. Moving on to our next flashcard. Now, this one we have done before. Let's see if you can answer. We have bluish-black connective tissue, ear cartilage and sclerae, and urine turns black on prolonged exposure to air. Think. The answer is alkaptonuria, that is caused by a deficiency of the enzyme homogentisate oxidase. This is also known as ochronosis. Moving on to our next flashcard, you see hepatosplenomegaly, pancytopenia, osteoporosis, avascular necrosis of femoral head, and bone crisis in a patient. Can you think of a diagnosis now? Gaucher's disease. Basically, Gaucher's disease is a lysosomal storage disease. In fact, it is the most common lysosomal storage disease. And in this, we have a deficiency of the enzyme glucocerebrosidase, also known as beta-glucosidase, that results in the accumulation of the previous product known as glucocerebroside, and this is an autosomal recessive disease. Now, diseases like this could be hard to remember, but if you follow our spaced repetition technique religiously, you are gonna definitely remember them without any effort. If you see cherry red spots on macula, can you think of a diagnosis now? So we have got two diagnoses over here. One is Tay-Sachs disease and the another is Niemann-Pick disease. Now both of these are lysosomal storage diseases. In Tay-Sachs disease, we have the deficiency of the enzyme hexosaminidase A and the accumulation of GM2 ganglioside, while in Niemann-Pick disease, we have the deficiency of the enzyme sphingomyelinase and the accumulation of sphingomyelin, and both of these are autosomal recessive diseases. Moving on to our next flashcard, Arachnodactyly, pectus deformity and downward lens dislocation. What do you think diagnosis is? Homocystinuria. It is an autosomal recessive disease in which there is an excess of homocysteine accumulating somewhere in the body. If we have elastic skin, hypermobility of joints, and increased bleeding tendency in a patient, now can you think of a diagnosis? Ehlers-Danlos syndrome. Basically, in the classical Ehlers-Danlos syndrome, we have type 5 collagen defect, but we have one subtype known as the vascular type, in which vessels, muscles, and organs are prone to rupture that is caused by a type 3 collagen defect. Next, gout, intellectual disability, and self-mutilating behavior in a boy. Can you come to a diagnosis? Lesch-Nyhan syndrome. It is caused by the deficiency of HGPRT or hypoxanthine guanine phosphoribosyl transferase. Mouthful of a name. An X-linked recessive disease in the salvage pathway where we have excess uric acid because of deficiency of this enzyme. So how do I memorize the symptoms? I have created a mnemonic HGPRT, same as the enzyme. The H stands for hyperuricemia, G for gout, P for pissed off as the person is actually pissed off, E shows aggression and self-mutilation, R stands for retardation, representing intellectual disability, and T stands for dystonia with T capital. Alright, that's all folks. Thank you for watching this video till the end. Make sure you subscribe to our channel for more content. See you soon.